Good afternoon, everyone. Welcome to our Living with Kidney Cancer panel with patients and caregivers today. And I will moderate the panel with guided questions, and then at the end, we'll open the floor to your questions. So to start off, I'll introduce myself, and then I'll go around the room and ask each person to introduce themselves. So I'm on the business side of healthcare. I work in for a health system in marketing and a strategy role, and I've had various roles in my career for different healthcare and financial services companies. And in 2012, my world changed, and myself and my family, we pivoted. I became a patient advocate and caregiver when my brother Monash was diagnosed with renal cell carcinoma in 2012. And really, our whole world changed overnight. We were navigating in this unknown world, trying to read as much information as we could on scientific research, talking to different people, understanding quality of life issues. And as Dr. Twaddle mentioned, healthcare power of attorney, all these new things we were confronted with, having to make decisions. We were also dealing with quality of life, diet and nutrition, and really just trying to get through the day. And so it was a lot. And it's my hope that as we go through this panel and hear everyone's different experience, that we can offer something of value to you as you go through your journey. So with that, I'm going to ask each of our panelists to introduce themselves. And we'll go in the order of Katie Coleman, Richie Johnson, and John Farrell. So Katie, over to you.
Hi, so I am Katie Coleman. I was diagnosed with a extremely rare type of kidney cancer in December of 2020. I had a metastatic oncocytoma and kind of went through various different treatment modalities. I was on systemic treatment for a little while before eventually I made it to a pretty large surgery that ended up taking care of most of my disease, along with I did some ablations shortly after that took care of the rest as well. Since then, I've been on active surveillance and kind of dedicated as much as my time as possible to kind of advocating and giving back because I feel very, very fortunate to be feeling as well as I do. So I also started a nonprofit this year, which is an affiliate of the KCA, the Chromophobe and Oncocytic Tumor Alliance. So that's kind of who I am.
Good afternoon. My name is Richie Johnson. I am a registered nurse by profession. And in 2011, my youngest son, Chris, was diagnosed with renal medullary carcinoma. And just as Benita said, when you hear the diagnosis of cancer, it tends to change your life forever in a matter of seconds. So fast forward a little bit, for 15 months, I was the caregiver for my son. And during the time that he was receiving treatment, he wanted to provide advocacy for others that were on this same journey with renal medullary carcinoma. I have dedicated my life to advocating for renal medullary carcinoma in hopes that no family would have to travel this unknown territory alone. So we formed the Chris C.J. Johnson Foundation in memory of Chris.
Hello, everyone. My name is John Farrell. I'm based here in Austin, Texas. I'm a kidney cancer patient and advocate. I was originally diagnosed in 2010 with stage 3 clear cell RCC, and at that time had my right kidney removed and had no evidence of disease after that. So fast forward 7 years to 2017. My cancer came back. It had metastasized to my lungs and my pancreas, and went into a clinical trial at that time, was in the trial for 2 years, and had a complete response, thankfully. But since then, I have been in and out of, I guess you can call it remission, or in and out of NED, no evidence of disease. and have gone through several treatments since then. So I think I've been told I had cancer probably 5 times now, but currently doing well, and still in, this is my 3rd clinical trial. I'm actually in one right now, not necessarily a non-FDA approved treatment, but a treatment to treat my cancer or any kind of mets that show up with anything other than drugs. So glad to be here and looking forward to the conversation.
Well, great to meet everyone again on our panel. So, one of the things that I found it with my family and my brother's journey is there were so many people who, once you got the diagnosis, you reached out to your network. I was fortunate, I work in healthcare, so I work with physicians, and I was able to get connections to other physicians. I was reading on the internet. I was on clinical trial sites and things like that. So, what did each of you do once you found out your diagnosis for renal cell carcinoma or your loved ones? What was the most helpful resource or thing or person that helped you in trying to figure out what to do?
I can chime in first here. I know for me, one of the most helpful things was joining support groups and reaching out and talking with other patients. That was really crucial for me, especially I got diagnosed on New Year's Eve. And so there was kind of holidays and there was some waiting period of time before I could get in and have my first appointments. And so leaning on other patients and joining support groups during that period of time really kind of helped me get a head start and learn about my disease. It also helped make me feel like I wasn't so alone because I was completely devastated. I think most of us are when you hear the words cancer. And so it really helped me to be able to connect with other patients and for them to be able to explain things in kind of layman's terms. Like it was easier for me to understand and connect with them. And then I was able to use that knowledge to look up resources on my own or ask my physician about. So they were a major source of support for me.
Yeah, that's a great point, Katie. Is the support groups that are out there, and even since I was originally diagnosed to today, there's so much more information that's available and resources. But one of the things that helped me as well, and as you arm yourself with that information and get those questions to ask, is a second and third opinion. So I made sure to get that second opinion, and I got a third opinion as well to better arm myself with information to make an informed decision. So that certainly helped a lot.
And then in my case, having a medical background was indeed helpful. However, with renal medullary carcinoma not really being discussed in the literature, it was very little information out there. And then what I did find was really not information I wanted to read. So my biggest support was my family, as well as my church family, and of course my friends. I would not have made it without that support system. So networking was extremely important. There were not any support groups available specifically for people diagnosed with renal medullary carcinoma.
Yeah, on the support groups, I'm just curious, Katie, how did you find them? Was it through the health system's website? Was it someone on your care team? How did you find them? Richie talked about her network of folks. How did you find them, Katie?
Yeah, in true millennial fashion, I turned to social media. So I looked on Facebook and kind of just looked for groups for any kidney cancer group. I pretty much joined them all. And then having a rare cancer myself, I can relate a lot to what Richie said. Is I was having trouble finding kind of some of the suggestions of what type they thought it could be at the time. And so I started searching hashtags on Instagram, on Twitter. I was literally just using social media and trying to find as much information as I could piece together.
John, you mentioned you were looking for second and third opinions and also clinical trials. How did you go about finding those opinions and those trials?
Yeah, that's a tough one, especially, I actually entered in a trial after my original diagnosis, and after my kidney was removed. It was a adjuvant vaccine trial, and I found out about that from my doctor specifically. But I had no idea really about clinical trials until I actually chose my doctor, and we started discussing various treatment options. And then I started, looking into the information that's in the NIH, and as Katie mentioned, some of these support groups online. Hey, has anybody heard of this trial or done trials? Where do I get information? And as I started, really getting into it and looking into this information, there's a ton of information. The other problem was understanding what this information meant, and all the acronyms, and PFS and CS and ORR, and so all these acronyms. So trying to decipher what information is in the clinical trial data, because it's very clinical, and hard to understand if you're especially if you're not on the medical side, or you haven't been doing this for a while. So yeah, it was really the internet and some of these the government websites like National Institute of Health and National Cancer Institute.
Great. So I'm going to shift the discussion a little to caregiver roles. So on the caregiver role side, I found myself in that role, and I know Richie talked a little bit about that as well with her son. And I'm sure there were people in your world, Katie and John too. But maybe Richie, you can share your experience as a caregiver. What were some of the challenges that you found yourself in this new role, and how did you get through what you had to go through to be there for your son?
I must say, being a caregiver for my adult son during this battle with renal medullary carcinoma was challenging and yet an emotional journey. As his caregiver, I learned the importance of resilience, coping with the ups and downs of his illness. It required a tremendous amount of inner strength. Um, I also learned to humble myself, and I found that my son was strong and resilient. And so watching him navigate through his treatment and the side effects of chemotherapy was disheartening because I felt helpless at times. I often became impatient while waiting for him to be seen by the medical staff because I knew he was in excruciating pain. And I had to learn to be patient. Um, I had to learn to become my son's advocate, navigating through all of his medical appointments and all of the treatment that he had to go through. But yet, I found that being a caregiver was both rewarding as well as challenging. It strengthened the bond between my son and myself. We faced this illness together, and it allowed me to learn him as an adult, because our children tend to grow up and they leave us, and you really don't know them as an adult. So I also learned the importance of the support that you do offer your caregiver, and then it has strengthened me so that I can support others on their journey.
Yeah, I wanted to touch on that, Richie, and you brought up some very good points. In between the time that I was originally diagnosed in 2010 and re-diagnosed in 2017, my wife was diagnosed with breast cancer in 2013, stage 3 breast cancer. The full, chemo, radiation, double mastectomy, reconstruction, the whole bit, and our cancers are very different, right? So chemo and radiation, traditional chemo and radiation for a breast cancer patient, and in her case was very physical, right? You lose your hair, whereas kidney cancer patients I'm living with stage 4 kidney cancer, and people's like, oh, you don't look like you have cancer, because it's true. It's not physical as much as some of the other cancers. So it is a lot harder. But to your point of leaning on that support system and not being afraid to accept the help. Everyone wants to help, and hey, we want to bring you a meal, we want to do this, and sometimes you feel overwhelmed to say, no, I'm okay, I'll be okay. But it's okay to accept that help and let people in, because I know a lot of times people shut down and they want to keep this private, but it really does help a lot to let family and friends help.
Yeah, I was going to say, for me, when you said the word resilience, Richie, I went into a gear that I didn't even know I had. And so I think you find the strength in yourself that you never knew, and you want to do everything in your power. And there is this impatience part to it and this humbleness part. And being the brave one when you know your loved one is the brave one going through what they're going through. Um, yeah, it's changed my life completely. Um, being an advocate and a caregiver. So I'm going to change our discussion to this word, and you mentioned this, John. I had never heard of these words from talking with my brother's care team, and it was living with cancer. I had this model on you got the diagnosis, you had the surgery, and you were then fine. But it was a whole new world understanding what it meant, living with cancer. What does to you, what does, I think we just said a technical thing. What does survivorship mean? What does living with cancer mean?
Yeah, it's a funny word, survivorship. I am of the belief that you are a survivor the day you're diagnosed. As I mentioned in my case, I've been in and out of remission 5 times now. So was I a survivor, and then when I was not a survivor anymore, I kind of look at it more of being a warrior. Instead of a survivor. Everyone that has been diagnosed with cancer is a survivor on that day. They're given that horrible news because you are surviving, and whether you are on a therapy or not on a therapy, or um, uh, cancer free or not cancer free for the time being, you're a changed person, and it is a new normal, and you are surviving. So it's it means a lot of things to different people, but that's kind of my take on it.
Katie, what about you?
Yeah, I know for me, it's meant different things at different point of time, different points of time for me. Um, when I was initially diagnosed, I really struggled with the term survivor because I was diagnosed stage 4 and my treatment goals originally weren't curative. And so I really struggled with that term until I heard the definition that John just mentioned of that you are a survivor from the day that you're diagnosed. And I truly do believe that. I think that's true regardless of the stage that you're diagnosed with too. I think the impact of hearing you have cancer, um, it has that impact no matter what stage you're diagnosed at. And so I know for me, when I was initially diagnosed and I was still in that phase where I was on treatment and my treatment goals weren't curative, survivorship meant learning how to kind of cope with that news, but still living my life in the meantime. Um, when I didn't know a whole lot about cancer when I was initially diagnosed, and so I didn't think that you could kind of continue on with your life at all, having stage 4 cancer, for example. And so I really struggled, and I was just in this headspace at the beginning of like, oh, I've just got to get to my next set of scans to know everything will be okay. And then I can do whatever thing. And it was constantly a game of trying to get that reassurance before I could live my life. And I eventually came to a place where I realized like we don't really know ever. There's not a whole lot of certainty about what the future ever is. And so learning to operate in the space that I am. So I started recognizing, how do I feel today, right here at this moment, and what is something that I can do right now, and starting to capitalize on that. So for me, while I was on treatment, that was like going for daily walks. Those were things that I really liked and appreciated. So that's what I focused my time on. So that's what survivorship was for me while I was kind of in the state where treatment goals weren't curative for me. And then after I had my surgery, my prognosis changed a bit. And it's been interesting to see a different side of survivorship, because while I was on treatment, it was constantly feeling like, okay, I'm planning for the next thing. It's just put one foot in front of the other. You have doctors that are supporting you every step of the way. And then once you kind of fall away and are off treatment, a lot of those resources and that support system you've come to rely on kind of falls away too. And so then you have to figure out, how do I navigate life going forward? Because my life is not the same as it was before I got my cancer diagnosis. So, what do I want it to look like now? And that's kind of the phase that I've been in now. Again, always have to have a watchful eye, for things, and trying to figure out, how do I live life and find purpose in that, while also keeping kind of the awareness of keeping up with scans and everything like that in the background.
Yeah, hey, I'll touch on it. It's a good point, but there's that thing of survivor's guilt too, right? We've been lucky that we're here today and we're talking and have these conversations, and different treatments, have worked, but there's, everybody responds differently, and we've lost quite a few friends throughout this journey that that didn't survive, but hey, they're still a survivor in my mind.
And I think too, it makes you appreciate life. You have a different perspective, and you tend to get joy out of the little things in life, versus, dreaming for something huge. So I think it just really does change your perspective.
Yeah, I completely agree with that. So on on this change, the survivorship, the change as a person on how you look at life. With every challenge, there's the negative parts and the positive parts, and I'm hearing a lot of positive. But what would you say, your experience, for each of you? Um, what are you taking away as something that's positive, based on what happened to you with this diagnosis?
I can kick us off here, I guess. So for me, um, it gave me a lot of purpose, which sounds very strange. And I know it sounds strange for people when I say, like, I'm happier now, honestly, than I was before my diagnosis. And so much of that, I think, goes to what Reggie was saying, was finding the joy in the little things. It gave me such an appreciation for life, and for every day, that I am a lot happier now, even kind of facing some of the things that I've faced. And there's a lot of power in that. It's also given me, the ability to give back, and that's been a big source of purpose for me. Whereas before I was diagnosed, I was 29, thought I was kind of finally starting to get my footing, but I wouldn't say that I felt like I had a purpose. And I do feel like I have a purpose now, and a lot of that has been given to me by other patients that, helped me along the way. And now I have a purpose where I want to give back to others, and I have a purpose of wanting to move research forward for rare cancers, since I had a rare cancer myself. So for me, that's looked like kind of sharing on social media, since that's kind of where I initially found a lot of my information at the beginning, as well as starting my nonprofit, as well to be able to fund research as well. So I would say purpose probably is the biggest positive thing I've taken away from it.
Yeah, I 100% agree. When you're faced with something like this, it can easily overwhelm you, and not be a positive experience, obviously. But my wife and I, with both of us being diagnosed with cancer, really looked at the blessing that was of the support that we had, of we had jobs, insurance, looked at all that, and said, how can we turn this around and make this a positive, and how can we make a difference? And To Katie's point about it making her a better person or being happier, 100% agree. It totally changed it around. It gave us a purpose. We started our own foundation, the Farrell Foundation. We've been able to donate over $100,000 to cancer research so far. And we've grown as our relationship has gotten better, our faith has gotten better. Our son, who's now 17, he was 5 when I was originally diagnosed, is, he's gotten into philanthropy a bit, raising money for the Leukemia and Lymphoma Society. So it's really made a positive impact on us. And again, it's so easy for it to go the other way. You got to find those little pieces that do give you purpose and do allow you to make a difference. And being here today, I mean, it's part of my therapy, and I'm sure everyone else's. How can if we can help somebody else in the process, then it's a win for everybody.
And I can tell you that losing a child is not the natural order of things. This was the most devastating thing that could have happened to me and my family. I could sit here, I can wallow and feel sorry for myself, but I chose to turn my pain into purpose. And that's why we started the foundation. I felt that no one should have to travel this journey alone. Renal medullary carcinoma is extremely rare. Very little was done. There was no research done. So being able to help others, seeing the progression of clinical trials, seeing the survivorship of others has indeed been a blessing. And that's how I find peace as I continue to help others.
I agree on what you've all said. The purpose, the helping other people, those are things that I also relate to. I found myself uh, volunteering for the Kidney Cancer Association, and I need to talk to all of you after this on your foundations, because I originally was interested in doing something for scientific research to advance it, because I think we need more funding for that and more solutions. So yeah, it changes your life and for the positive, I think. Um, so, we talked a little bit about this, and that's the support systems and comfort and kind of new normal and resetting the deck in your life. So before kidney cancer, we all had sources of comfort and things that we like to do. Was there anything that you can offer on your experience on what you found yourself seeking comfort based on finding out about kidney cancer?
For me, I was a newlywed when I got diagnosed, so it probably wasn't like too far in advance before I got diagnosed. But my husband was a major support system and comfort for me, especially because my husband and I moved across the country in order to pursue treatment, and so he was kind of all I had. And so he was a source of comfort. And then probably outside of that, my pets, like turning to my dog as a emotional support animal apparently at this point, and just having some of those things in my life that existed before the cancer are things that have brought me joy and comfort.
Yeah, 100% agree. Pets are great support systems. My dog's laying right next to me right now, and she's been with me through this whole journey, as well as my newer rescue dog. But yeah, I mean, friends and family, huge support system. Other patients, as I mentioned, I've been in 3 clinical trials. One of the trial I was in was 2 years, and I was going to the hospital every week. And you get to meet other patients and other folks that are going through this journey with you. And not just that, but the technicians, the doctors, the nurses, the PAs, everybody that you come across, the phlebotomist that drew my blood all the time. I always went back to the same person, and she's now retired, so I miss her because I just went last week. But you start building this team of people, and even some friends and family that kind of come out of the woodworks. tend to check in on you every now and then. And so, the big thing is let those people in, and you'll reconnect, very closely with a lot of friends, and reconnect with some old friends. So it's been great, from my perspective.
And I have to agree with everyone else. I think family and friends were the main source of comfort. I didn't have any pets, so I had to lean on them. And I think what's so great is that they didn't ask, "What can I do for you?" They just came and did. They can sense in my voice when something wasn't right. And so they were there. And that in itself was a sense of comfort.
Yeah, I think comfort comes in many different ways. Food, favorite foods. We brought my brother favorite foods, memories. Having conversations on different things that we did together. Only inside language that brother and sister would know about. So different things like that I think are helpful to find comfort. So I think we're coming up on the end of our panel discussion, and I'm trying to see if there's any questions from the audience. And so we're opening it to the audience if there's any questions. And I'm not seeing any right now. So feel free to type your questions in. And maybe what we'll do is we'll just go around the room and just do a final closing comment. So why don't we start with Katie?
Sure. I think my closing comment, if we're sharing kind of words of advice or things that I would share to other patients and takeaways from the session is, one, the role that other patients and support that other patients can provide can be. I think it's incredible the different ways that we can all connect with each other and we can bring a lot of support. So never ever hesitate to reach out. I'll just say that personally for me. If you see me on any of the platforms or anywhere, never hesitate to reach out to me. But also want to drive home the fact that, like, I think we've talked a lot about positivity and kind of the positive things that we've taken away from this diagnosis, but also recognizing that there are hard days. And so those are the times that it's really important to lean on others and let them in, as John and Richie have mentioned as well too, because there are hard days. And I think what's driven me to have a positive outlook was the influence others had on me. So always important to acknowledge that even if it doesn't feel like you're in the good days now, that doesn't mean that they're not ahead of you.
Yeah, absolutely, and certainly echo Katie's comment about hard days, because like I mentioned, just when you think everything's great, then you kind of have a setback, and you just got to keep powering forward. So but to that point, letting people in and having that support system, and don't be afraid to get involved. And that has helped me kind of put the diagnosis aside and find that purpose, as Katie mentioned earlier, not with just helping patients, but with advocacy. Talking to your senators and Congress folks and everyone about funding, because what's happened in the past 13 years since I've been diagnosed is there's so many treatments available, FDA approved, and so many trials available as well. So it's only going to help you down the road, as more treatments become available and we get closer to making this a chronic disease. So yeah, just get involved. It'll help you.
Okay, well, I think that yes, you will have your good days and your bad days, but the important thing is to remember that even during your bad days, try to find something good out of it, and remain positive. As a caregiver, it is so important that you try to take care of yourself while you're taking care of your loved one. We often tend to sacrifice ourselves, and if we're not well, then we're not going to be able to assist our loved one the way we should. So remaining positive is the main thing that I would suggest that each and every one of you would do. And remember that you're not alone. We're all here to help you in any way that we can. And it's extremely important that you be an advocate for your loved one as you travel this unknown territory.
Yeah, well said, everyone. And I would just close with kind of adding on to what Richie said. Do one positive thing for yourself as the caregiver, and it's okay to step away. It's okay to take a break. It's okay to say you can't handle it for that moment. And tomorrow's a new day. So with that, I'd love to thank our panelists, Katie, John, and Richie. Thank you so much for sharing your experiences and your words of wisdom. And for those that are watching, if you should need help, the KCA has a patient navigator program. So feel free to connect to that for additional resources to help you with your kidney cancer